Hello, very good evening everyone. How are you guys? Is everything fine at your end? We are going to start our session today, and please acknowledge, is everything fine? Audio video is fine, okay? So we have gathered today to discuss certain important questions which are important from our exam point of view, okay? And we will go a little bit here and there to discuss also about it, right? About the topics basically, okay? So let us now start our discussion, okay? And this is a question. A patient present with the mandibular hypoplasia. A boy has developed hypodeveloped mandible or chin. Basically, this is defect is due to what? So I have taken this topic from the pharyngeal arches. The idea is to discuss the pharyngeal arches with you guys, because as we know, the pharyngeal arches, pharyngeal pouches, all these are very, very important areas from where the questions are asked. So obviously all of you are correct. Very good beta. Chandani, डॉक्टर विनीत, ऑल ऑफ यू आर करेक्ट, है ना. इसमें आंसर क्या बनेगा? फर्स्ट आर्च, क्योंकि हम जानते हैं कि मैंडिबल का जो पार्ट है एंड द एडजॉइनिंग एरिया, राइट, दैट विल बी डेवलप्ड फ्रॉम द फर्स्ट आर्च. सो लेट अस रिवाइज दिस टॉपिक बेसिकली, ठीक है, एंड देन वी विल प्रोसीड विद द नेक्स्ट एरियाज, बिकॉज इंपॉर्टेंट एरिया में क्वेश्चन के बियॉन्ड भी इंपॉर्टेंट कंसेप्ट हम लोग डिस्कस करते चलेंगे, ठीक है. चलिए स्टार्ट करते हैं. So we are looking at right now the arches are there, nerves are there. For each arch we know the nerves. We know from each arch there are muscle derivative and the skeleton derivative. तो मैं थोड़ा सा easy करता हूँ आपके लिए कि कैसे याद रखना है, ठीक है. सबसे पहले nerves. So nerves के लिए हम याद रखेंगे one mnemonic, that is my friend gave some rupees. ठीक है, वेरी गुड चांदनी, आपको निमोनिक भी याद है, बहुत अच्छी बात है. दिस इज हाउ वी शुड रिवाइज, कि हमें सारा कुछ अच्छे से याद हो जाए. गुड बेटा, गुड. इरफान, दीपिका, एवरीवन, यू आर गुड बेटा, वेरी गुड, शाबाश, बहुत अच्छे. माई फ्रेंड गेव सम रुपीज. माई से मैंडिबुलर नर्व है फर्स्ट आर्च के लिए, सेकंड से फेशियल है, थर्ड के लिए जी से ग्लोसोफेरेंजियल है, देन सुपीरियर लैरेंजियल एंड द रिकरेंट लैरेंजियल. नाउ सिंपल, बड़ा सिंपल रखते हैं इसको, ट्राई टू कीप द थिंग सिंपल, ठीक है. अब हम आ जाते हैं नेक्स्ट पार्ट पे, मसल्स और स्केलेटन के लिए. मसल और स्केलेटन के लिए मैं आपको याद करवाऊंगा, लेकिन उससे जस्ट पहले मैं एक छोटा सा आपको एक आइडिया बताता हूं, बेसिक आइडिया, कि हम अगर एक बेबी के ग्रोथ को कंसीडर करें तो उस हिसाब से हम सोच सकते हैं. कैसे? सबसे पहले जो बेबी का जन्म होता है तो सबसे पहले उसका क्या कंसर्न होता है? फीडिंग. तो जो फर्स्ट आर्च है वो मेजरली रिलेटेड है फीडिंग से, ठीक है. बाद में हम आएंगे कि कैसे. फिर जब बेबी थोड़ा बड़ा हो जाएगा, राइट, तब वो स्माइल भी करेगा, है ना. तो सेकेंड आर्च में इन्वॉल्वमेंट है स्माइल का, यानी कि फेशियल मसल्स का, क्योंकि स्माइल के लिए हम फेशियल मसल्स यूज करेंगे. उसके बाद बेबी थोड़ा और बड़ा होगा, उसको थोड़ा स्टाइल भी आ जाएगा, थोड़ा बेबी का स्टाइल आ गया. एंड उसके बाद जब बेबी और बड़ा हो जाएगा, अब वो स्टार्ट करेगा सिंगिंग. तो सिंगिंग के लिए हमारा मेजरली लैरिंग्स, जो वॉइस बॉक्स है, और सराउंडिंग एरिया लाइक फेरिंग्स का भी इन्वॉल्वमेंट हो जाएगा, ठीक है. तो अब ये हमारी एक बेसिक आउटलाइन बन गई कि हमें इस एरिया में सोचना है, ठीक है. अब हम स्टार्ट करते हैं स्पेसिफिकली. जैसे फीडिंग किससे होगा? मैस्टिकेशन. तो हमारे अगर हम स्केलेटन की बात करें तो ये वाले अराउंड के जो हमारे मसल्स स्केलेटन बनेगा, यानी कि हमारा मैंडिबल बनेगा, मैक्सिला बनेगा, है ना, प्री मैक्सिला बनेगा. उसी के साथ साथ हमारा मेलियस और इंकस भी यहाँ से ही बनेगा, ये भी हमें याद करना होता है. ओके. और सेकंड वाले एरिया से अगर हम बात करें, सेकंड जो आर्च है, यहाँ से क्या बनेगा? यहाँ से हमारा, क्योंकि फेशियल नर्व है तो हमारा यहाँ से एक स्टेपिस रहता है, स्टेपिस बोन, क्योंकि वहाँ पे अटैचमेंट होता है स्टेपिडियस का, राइट. बेसिक आइडिया. नाउ दिस इज अबाउट द स्केलेटन. लेट अस टॉक अबाउट द मसल. ओके. मसल की अगर हम बात करते हैं तो लेट मी गिव यू वन मोर निमोनिक हियर. माई निमोनिक इज लाइक माई मस्ट आंट डाइजेस्ट टेंशन. ये हमें सिर्फ फर्स्ट आर्च के लिए याद रखना है. वंस यू नो दिस निमोनिक, एक तो हमें फर्स्ट आर्च की मसल्स याद हो जाएंगी, फिर हम सेकेंड आर्च की डिराइव कर लेंगे. कैसे? स्टार्ट करते हैं. माई से माइलो हायोइड मसल. मस्त से मैस्टिकेशन मसल, मैस्टिकेशन ग्रुप, ठीक है। और उसके बाद हमारा क्या है, आंट डाइजेस्ट यानी कि एंटीरियर बेली ऑफ डाइगेस्ट्रिक। फिर टेंशन में क्या है, टू टेंसर्स मसल, दैट इज टेंसर पैलेटिनी मसल एंड टेंसर टिम्पेनाई मसल, ठीक है। तो दीज आर द मसल्स विच आर डेरिवेटिव ऑफ द फर्स्ट आर्च। देन वी हैव सेकंड आर्च। अब सेकंड आर्च कैसे याद करेंगे, देखो यहाँ पे माइलोहायोइड है फर्स्ट आर्च से, तो सेकंड आर्च से बनेगा स्टाइलोहायोइड, मैच कर रहा है माइलोहायोइड स्टाइलोहायोइड। यहाँ पे एंटीरियर डाइगेस्ट्रिक है तो यहाँ पे पोस्टीरियर डाइगेस्ट्रिक। इनफैक्ट एंटीरियर डाइगेस्ट्रिक और पोस्टीरियर डाइगेस्ट्रिक में बहुत बार क्वेश्चन आया हुआ है। फिर यहाँ पे एक ग्रुप था मसल ऑफ मैस्टिकेशन, सेकंड आर्च में भी ग्रुप है मसल ऑफ फेशियल एक्सप्रेशन, ठीक है। और लास्ट में क्योंकि यहाँ पे स्टेपिस बोन था, उसके साथ स्टेपेडियस मसल होगी, तो दैट विल बी द मसल फ्रॉम द सेकंड आर्च। तो थोड़ा सा हम उस हिसाब से सोच सकते हैं। आर यू अंडरस्टैंडिंग, ठीक है बेटा। फिर थर्ड आर्च से वी हैव ओनली वन मसल, दैट इज स्टाइलोफेरेंजियस, दिस द ओनली मसल सप्लाइड बाय द ग्लोसोफेरेंजियल नर्व। फिर फोर्थ आर्च से हमारे मसल ऑफ पैलेट एंड फेरिंग्स है, और सिक्स्थ आर्च से हमारे मसल्स ऑफ लैरिंग्स है, राइट। सो इसके अलावा एक लास्ट पॉइंट जो मैं यहाँ पे ऐड करना चाहता हूँ वो ये है कि हमने ना फर्स्ट आर्च का एक नेम होता है, फर्स्ट आर्च का नेम होता है मैंडिबुलर आर्च, जैसे हमें आइडिया लग रहा है फीडिंग के साथ मैंडिबुलर का इन्वॉल्वमेंट होता है। सेकंड आर्च का भी नेम होता है हायोइड आर्च, बट इंटरेस्टिंगली नेम भले ही सेकंड आर्च का हायोइड आर्च है, कंप्लीट हायोइड बोन सेकंड से नहीं बनती। सो सेकंड एंड थर्ड मिला के हायोइड बोन बनाते हैं। विच पार्ट ऑफ द हायोइड बोन विल बी मेड बाय द सेकंड आर्च। सेकंड जब हम लिखते हैं तो एस से आता है ना, एस फॉर सेकंड, तो आप याद कर सकते हो स्मॉलर पार्ट, स्मॉलर हॉर्न और लेसर हॉर्न, स्मॉलर और लेसर हॉर्न, और दूसरा सुपीरियर बॉडी, एस फॉर सुपीरियर। तो स्मॉलर हॉर्न एंड द सुपीरियर बॉडी विल बी कमिंग फ्रॉम द सेकंड आर्च, ओके। स्मॉलर हॉर्न एंड सुपीरियर बॉडी। और अगर यहां पे बात करो, जो रिमेनिंग पोर्शन है वो थर्ड आर्च से बनेगा, ऑलराइट। थर्ड आर्च से दैट वी विल गेट द ग्रेटर हॉर्न एंड द inferior bone. Alright, Deepika, no problem, I will do that. So what I have told that even though the name of the second arch is hyoid arch, okay, but the complete hyoid will not be made by only second arch, it will be made by both second and third arch. Second arch, because S for second, so it will make smaller horn or the smaller cornu and also superior body. So smaller horn will made by second arch, what is left, greater horn will be made by third arch. Superior body already made by the second arch, inferior body will be made by third arch. So this is how we can remember. So basically I have tried to give you a little bit outline and ideas based on which we can remember it. Give me quick feedback, dear students. Have you understood the nerves? We have a mnemonic for the nerves. Muscles, I have given you the mnemonic as well as the rough idea where to think about these muscles, and the skeleton also. Have you got the understanding better now? Please give me quick feedback. Have you understood this much part? Yes? Can we proceed with the further portions, right? Along with the second, these pharyngeal arches, what is important is the pharyngeal pouches. Pharyngeal pouches, like we have 4 pouches are there, and this is where we need to memorize it. First arch, first pouch. Pouch will be, what is the difference? Pouch is endodermal structure. First pouch will make the tympanic cavity and the auditory tube. Second is concerned with the tonsil. Third will make thymus, and fourth will make ultimobranchial body. Alright, and apart from that we have parathyroid. This is other way around. Third pouch will make inferior parathyroid, and fourth pouch will make superior parathyroid. So it is opposite. We may think it third is above, fourth is below, but third will make inferior, fourth will make superior parathyroid. It is other way around. Okay, very good. Chalo, bahut अच्छे, शाबाश. And regarding this, we need to also remember the arteries. These are directly asked areas if at all they ask. Okay, so first, now how to remember this? See, first impression usually we say is the last impression, okay, but for timing, if we consider first impression is the maximum impression, so first is maximum. If first is maximum, we can consider maxillary artery will be the derivative from the first arch. When you write S, Second we start with the S word, right? So we can say S for stapedial artery and hyoid artery. And for the third arch, when we write like alphabets A, B and C, so third alphabet is C for carotid system. That means we have carotid artery, common carotid, also carotid artery, internal carotid, but not the external carotid, because external carotid is not a direct derivative, rather a new branch will be given which will make the external carotid artery. Till now there is nothing left and right, but for the fourth arch we have left and right different. Left side may we have arch of aorta, right side may we have right subclavian artery. And then sixth arch artery, also again left side and right side we have pulmonary artery, but this left side may additional we have ductus arteriosus from the distal part, This is again very important. It was asked in a recent exam, okay, that what is the derivative of the sixth arch artery on the left side in the distal part. Answer was ductus arteriosus, right? So this area is very important. That's why we have emphasized here. Now let us proceed. Identify the march structure. Yes, dear students, what is your answer now? Tell me. This is caudate nucleus. Right? Let me show you here that we have, like, if I zoom in and show you, this is the caudate nucleus, this is thalamus part over here, and this will be the lentiform nucleus over here, right? Like this you can see. Now this is caudate nucleus over here, this is thalamus, this is globus pallidus, and this is putamen. And if you take it together, this is corpus callosum, this is caudate. This completely, if you take these two nuclei together, is the lentiform, but outer is the putamen, inner, which is paler, is the globus pallidus. Now dear students, can you, yeah, that is true. Yes, Dr. Vinit, that is true. Can you please tell me if what is this structure over here? What is this structure over here? This is internal capsule, as you have already identified. Okay? And what is the name of this part of the cortex which has gone inside? What is this part which has gone inside? This is called as insula. This is called as insula. Yes. Okay, very good, beta. Shabash. Now this question, paracentral lobule is involved, then which region of the body will be affected? It's like we know the trick. What is our trick? When we write paracentral lobule, the first word will tell you perineum and leg. Okay, so perineum and leg are representing in the paracentral lobule. Straightforward, very important part. Okay, this is the homunculus part, motor and the sensory. Okay, and the paracentral lobule is where we have the leg and the perineal region. Now what is the answer to this given defect? What is the given defect? We can see the cleft upper lip. Cleft upper lip is because of what? Cleft upper lip is because of the non-fusion of maxillary process with the medial nasal process. That will be the correct answer here, right? And if at all they give you this B choice, non-fusion of the maxillary with the lateral nasal process, can you tell what will happen? See, maxilla makes the cheek and the lateral nasal means this part of the nose. If the cheek and the nose, they don't meet, there will be cleft on the face. So if the lateral nasal process is given, that means it is the facial cleft they are talking about. It is the facial cleft they are talking about. But if they are talking about maxilla with the medial nasal process, then we can say it is a cleft upper lip. So here you can see one frontonasal process, these two are the maxillary process, and these two are the mandibular process. Okay, mandibular process will fuse very early to make the lower lip and chin. And when the nasal pit is formed, after the nasal pit formation, there is yellow color medial nasal and the blue color lateral nasal process. And eventually these medial nasal processes will approach each other like this, and they will meet and they will make the upper lip. So ultimately upper lip is made by four processes. What are these? Maxillary process, medial nasal process, again medial nasal, and then maxillary process. And wherever there is non-fusion, it will lead to cleft. It will depend ki where is the non-fusion. Okay, this concept is clear. This is important area, right? Now the same processes which make the lip at the surface, at deeper level they are making the palate. That's why it is, although not mandatory, but quite oftenly seen together, cleft upper lip and cleft palate. Now lacrimal sac is present in which wall of the orbit? Now this is important. Let me show you the picture here. You can see that if they ask lacrimal sac, that will be in the medial aspect, but if they change and they ask lacrimal gland, then it will be the lateral aspect, superolateral aspect. So answering this question will be medial. In Bell's palsy, which of the following part is paralyzed? In Bell's palsy, which of the following part is paralyzed? Yes, what do you think? In Bell's palsy means it is your seventh nerve injury. It is element type lesion. Then ipsilateral half of the surface, ipsilateral half of the face will be paralyzed. But in case of UMN type lesion, there will be contralateral lower half will be involved. Here you can see, if Bell's palsy is given, it is element type lesion, ipsilateral half of the face is gone. But in case of UMN type lesion, there will be contralateral lower half of the face will be gone. Okay, now this question, which of the following will be injured if the march structure is gone here? So basically this is given in the medial aspect of the elbow. So medial epicondyle is where we have the ulnar nerve present, right? Behind the medial epicondyle we have ulnar nerve present. So this is important. Also you need to remember, if they ask you Guyon's canal syndrome, or if they give you fracture of hook of hamate, again you need to know that it is about the ulnar nerve injury, because ulnar nerve is present beneath the hook of hamate. Okay, now this level, tell me what is the vertebral level of the march structure. So march structure is the sternal angle. Okay, but when we talk about the vertebral level, some students they get confused over here, that sternal angle is responsible, like it is showing you the level of the second rib. That is true, but the question is not about the rib, question is about the vertebra. If you see behind, answer will be disc between T4 and T5. How will you remember this? You can remember this because we take the plane to divide the mediastinum at the same level, and this plane passes anteriorly at the sternal angle level, and behind it passes through the disc between T4 and T5, like this. So far so good. Would you appreciate this? Clear, no? T4 T5 ka disc, like that. Now this question, beta, what do you think will be the answer? A patient coming with the elbow fracture and the forearm is pulseless. Tell me, what do you think will be the answer? Because the forearm is pulseless, definitely when the elbow was fractured, the vessel, the big vessel in front of the elbow is gone. What is that? Brachial artery. Let us see. So here we have, this is we have median nerve, brachial artery, biceps tendon, and the superficial branch of radial nerve. Okay? And brachial artery can be injured in case of elbow fracture. Yes, it can involve. So that is what it will lead to, the brachial artery gone. That means there is no pulse here in the forearm. It will become pulseless. During examination, when the patient was asked to stand on the left foot, means patient is standing on the left foot, that means right foot is in the air, off of the ground. and the right hip is dropping. This is because of paralysis of which of the following muscle? Now first point, when the right foot is off of the ground, whose duty was it to prevent the fall on the right side? Which sided muscle should have worked? It was the duty of the left sided muscle. Okay, which muscle specifically? It was the duty of gluteus medius and gluteus minimus. If you have to choose one, go with gluteus medius only. But if you have to choose like two, if you can choose, specific answer should be medius and minimus. That's why answer to this question will be D, gluteus medius and minimus of the left side. But this is very important area, right? Can you tell me the name of the sign here? And also, can you tell me which nerve is being tested here? Which nerve lesion will lead to this? This is because of superior gluteal nerve, because superior gluteal nerve supplies these two muscles, right? Along with one more muscle it also supplies, that is tensor fasciae lata. But basically it is going to supply these muscles, and this sign is, as you have told already, very good to see that you guys are telling all the correct answers. That is Trendelenburg sign. And also, if you can tell me, let us discuss this. What is the name of the gait? If it is unilateral, what is the name? If it is bilateral, what is the name? Okay, there will be two gaits, one for the unilateral, one for the bilateral. So name of the sign is Trendelenburg sign. Name of the nerve is superior gluteal nerve. Name of the muscles, gluteus medius and minimus. And which side? Opposite side. Right hip is dropping, left sided structures. And the name of the gait is lurching gait. If it is unilateral, we say lurching gait. But if it is bilateral, then we say waddling gait. Okay. Here you can see this is the normal picture of the pelvis, both the hips together, and this is the Trendelenburg sign. When the leg is in the air, that means off of the ground, the other muscles are not able to support it, hip is tilting. This hip tilting is called as the positive sign, positive Trendelenburg sign. So far so good. Now what are these, which area showing the marks of the atrium? Which part is showing the atrium? This is to give you the information regarding this part, that you can get this type of indentation. Okay, let us start from below upward. Try to understand this. Let us start from below upward. When you go from below upward like this first indentation you can get because of the left atrium. Just above you can get the left bronchus, and further above you will get the aorta. So these are the three indentations you can expect in the chest x-ray, right? Do you appreciate this? That because of these structures some constrictions are seen, that means, right? A clinician finds some resistance when he was passing the endoscope around 22 centimeter from the incisor tooth. Till which landmark the endoscope has reached? Again it is concerned with the constriction. Okay, again this question is similar, but it is concerned with the constriction, that because of which structure there is constriction. So at the level of these different parts, we have in the constriction in the esophagus. So we have the first constriction which is at the pharyngoesophageal junction. Let me tell you easy way to remember this. Okay, first of all remember C6, because C6 is important level. C6 is the level where pharynx will become esophagus and the larynx will become trachea. तो C6 पे दो इवेंट हो रहे हैं, larynx बनता है trachea, pharynx बनता है esophagus. तो C6 we have to remember, this is where we have the beginning of the esophagus and there we have the narrowest part. Okay, constriction यहाँ पे सबसे ज़्यादा होगा. Sorry. And after that we need to remember 4 plus 6 equal 10, means rest three constriction level are T4, T6, T10. Now because of what we have this level constriction happening? First constriction is the beginning of the esophagus, that means that pharyngoesophageal junction. Fourth is when it enters the diaphragm, right? Diaphragmatic opening. And second and third are because of the crossing. Which crossing? Arch of aorta and the left bronchus. We have already seen similar type in the X-ray. And what is the level? Here we can see the 6 inch, 9 inch, 11 inch and 15 inch. 6, 9, 11, 15. Okay. Right, this is how the constrictions will be seen. Now this is kind of hot favorite. They give usually one question on this planes part. Okay. Now what is the level of this marked plane? So what will be the answer? To understand this, let us see this diagram also again. What is the vertebral level for red color plane? So some question will be given and then they will be asking कि इसका plane का level क्या है. हमें समझना ये है. Basically what we need to understand. Let me tell you this here. Understand here. This you look at the umbilicus level first of all. Okay. First of all you look at the umbilicus level. Umbilicus का level is at disc between L3 L4. Umbilicus is present at the disc between L3 L4. But if you have to choose one, you can, or clinically we consider L4. Clinically we consider L4 also, no problem. But specifically L3 L4. And if you see, you get these two type of plane. If the plane is below the costal margin, then it will be subcostal, and then its level will be L3. But if the plane is cutting across the costal margin, not below the costal margin, then its level will be L1. Okay. And if you see the plane is below the umbilicus, it will be mostly transtubercular plane, which we take at the L5 level, which passes through the tubercle of the iliac crest. Okay. So these are the level: transpyloric L1, subcostal below the costal margin L3, transtubercular that is L5 level. Okay. Now you see this. What structure passes through the marked foramen? Here we have three openings, right? IVC opening, esophageal opening, and aortic opening. Okay. IVC opening, esophageal opening, and aortic opening. And through the aortic opening, the question is talking about, we can remember by simply remembering this structure, ATA. What is A is aorta. What is A is aorta. What is T is thoracic duct. And what is A? Next A is azygous vein. So among these, thoracic duct is given, that will be the answer. What structure will pass from the IVC opening? It will be IVC as well as right phrenic, only right phrenic, not both phrenic. And from the esophageal opening, it will be esophagus, along with that left and right vagus. Okay. So here you can see IVC opening, you can see esophageal opening, you can see aortic opening also. And what will happen in case of inspiration? In the inspiration, IVC opening will dilate. How will we remember? Because the venous return is increasing in the inspiration. And the esophageal opening will constrict, and there will be no change in the aortic opening like that. Yes. Can you tell me which of the following contains the splenic vessel? Yes. Can you tell A, B, C, D? Which of the following considered the it is having the splenic vessel? What is your answer? So what is C here? Let me write all these structures which we can see here. This is the liver, this is stomach, this is spleen, this is kidney, right? Vertebrae, aorta, IVC, right? And this is the suprarenal gland. And here we have gastrosplenic ligament, and lower down this is linorenal ligament. And both of them, they have one artery. Gastrosplenic ligament is having the short gastric artery. It is having short gastric artery. Linorenal is having the splenic artery. Now the question is कि later how will you remember which one was present where? So short gastric artery and the splenic artery. तो हमें याद रखना है the name of the ligament. First word in the name of the ligament will tell you the name of the artery. Gastrosplenic, first word is gastric artery. Linorenal, first word is lino, so splenic artery. Lino मतलब spleen. Are you understanding? So gastrosplenic में तो बेटा short gastric artery आ जाएंगे और linorenal में splenic artery आ जाएंगे. ठीक है? First word से आपको पता लग जाएगा. What is A here? A is the lesser omentum, and the lesser omentum free margin is having the portal triad structure. It is having the portal triad structure. Portal vein, hepatic artery, and bile duct. But it will not have the hepatic vein because that is not a part of portal triad part. Okay. And what is present in the B? It is along the lesser curvature. So in the lesser curvature of the stomach, we have the left gastric majorly, and also we have the right gastric. Along the lesser curvature, we have two gastric arteries. Okay. So here you can see the diagram where we have the gastrosplenic artery having the short gastric artery. This is linorenal artery which is having the splenic artery. Is it making sense now? ठीक है? All good? So far so good? Next question. A cyst is observed in the anterior part of sternocleidomastoid. It is due to persistence of the which of the following cleft? See, we have discussed pharyngeal arches in detail. We have discussed pharyngeal pouches also in detail. In fact, we have discussed the pharyngeal arch arteries also. But what about the pharyngeal cleft? Pharyngeal cleft is present on the outer aspect. Okay. So what happens in the pharyngeal cleft? Initially, we have 4 clefts. 1, 2, 3 and 4. But what happens that the second arch will overgrow on the outer aspect. When the second arch will overgrow on the outer aspect, there will be this gap created. This is called as cervical sinus. But this gap is very temporarily present. It will be filled. It will be filled. It will be basically lost. Okay. So this will become branchial cyst or fistula. Okay. If at all it is not going to, if at all it is not going to obliterate. Okay. And the first cleft will be making the external acoustic meatus. But this is the traditional teaching that we say first cleft is making the external acoustic meatus. Okay, this earlier we used to say that first cleft is making the external acoustic meatus. But in the latest book of Langmann's, Langmann 14th edition, it is given that it is the first arch which will make the external acoustic meatus. Okay, could you appreciate this? So yes, that is true, Dr. Nisi, as you have told, it will be the combined second, third and fourth, but predominantly it is the second. So because if the choice is given like second, third and fourth, we can mark that because all 3 are involved. But if we have to choose single one, then second is the answer. So we will go and mark the second cleft. Could you appreciate? So now if they ask you what is the derivative of the first pharyngeal cleft, nothing. It is replaced by the arch cells. Okay, and then the arch cell will make the first external acoustic meatus. Okay, and if I ask you which structure is derivative of all 3 germ layers, yes, can you tell which structure is the derivative of all 3 germ layers? That will be tympanic membrane. Tympanic membrane is the derivative of all 3 germ layers. All right. Now, which one is wrong here? So this is the axillary artery. Let me quickly give you the branches of the axillary artery, then I will show in the diagram. Then we'll come to the answer. So axillary artery branches can be remembered by the mnemonic. What is our mnemonic? The mnemonic is salt spa. Our mnemonic is salt spa. So here we have like S for superior. We add the word T, it becomes thoracic. So superior thoracic. T is the commonly used. ठीक है, T को हम common में use करेंगे. कैसे? A for acromio. Acromio, we will put T, that is thoracic. It becomes acromiothoracic. Then L for lateral, then thoracic. It becomes lateral thoracic. Superior thoracic, acromiothoracic, lateral thoracic. Then what is S? Is the subscapular. What is P and A? That is pacha and acha. What is pacha and acha? That is posterior and anterior circumflex humeral artery. Okay, like that. These are the branches for the axillary artery, we can say. First point. Second point, let us now identify these. Let us now identify these arteries. Like, let me show you. Here we can see the first rib. This is the subclavian artery coming. Beyond the first rib, it becomes the axillary artery here. And this is the first artery here, that is superior thoracic artery. Superior thoracic artery. और ये क्या है? That is acromiothoracic artery. This will be the lateral thoracic artery, subscapular artery. This will be acha and pacha. बेटा इसका PDF कहाँ पे मिलेगा? ये like we will upload maybe on the app, है ना? ऐप पे हमारी eMedicoz ऐप है ना डैम्स का, वहाँ पे हम इसको अपलोड कर देंगे. ठीक है, यहाँ समझ आ रहा है आपको? यहाँ तक समझ आ गया? अभी हमने जो ब्रांचेस देखी उस हिसाब से व्हाट इज डी? डी तो यहाँ पे होना चाहिए था सबस्कैपुलर, राइट? यहाँ पे दिया हुआ बच्चा, दैट इज व्हाई दिस इज द आंसर, इट्स रॉन्ग हियर. Now what is this muscle? Let us zoom in and see. Here we can see this is the, like, what muscle you wanna try? Tell me what is the answer. Styloglossus लग रहा है? Palatoglossus. Styloglossus तो behind से आएगा ना, styloid process से. Obviously answer straightforward here. Genioglossus. It starts from the genial tubercle here, going to the this part, that is glossus part. Genioglossus is the muscle. And what is the safety muscle of the tongue? What is the safety muscle of the tongue? You wanna tell? Safety muscle of the tongue is the same, genioglossus. And what is the safety muscle for the larynx? That is different. Safety muscle for the larynx बोलो क्या होगा? Yes, very good. So अभी तक की अच्छी बात यह है कि all of you guys are answering also well, you are interacting well, and I can really tell that you give your best shot, okay? And this time you are going to crack the exam. I am very hopeful for you guys, okay? Just maintain the positive rhythm of your study, okay? Do not give up, and God will definitely bless you. Just give your best shot, ठीक है? हमें अपना काम ठीक से करना है बस. अभी तक ऐसे लग रहा है कि आपकी तैयारी ठीक चल रही है, आप सही जा रहे हो. All right. All of the following are paired except. So इसमें हमारा paired कौन सा नहीं है? That is the thyroid cartilage. Thyroid cartilage is not paired here. Rest three are paired, right? So thyroid, cricoid, and epiglottis, these are unpaired, है ना? Big cartilages are there. All are true about thoracolumbar fascia except. Now let me teach you this thoracolumbar fascia, then we'll talk about this question. So here we can see that we have the vertebrae, lumbar vertebrae specifically. By the side of it we have the psoas major muscle, we have quadratus lumborum muscle, we have this erector spinae muscle. And if you see this way, we have one layer, anterior layer, this is middle layer, and this is posterior layer of thoracolumbar fascia. This is thoracolumbar fascia. So we have three layers of thoracolumbar fascia: anterior, middle, and posterior. But on the other side, thoracolumbar fascia is attached to transverse abdominis, also internal oblique. This one is transverse abdominis, this one is internal oblique. This one is external oblique, which does not have any connection with the thoracolumbar fascia. Do you appreciate this? Could you understand? So thoracolumbar fascia is attached to the spinous process. Yes. Attached to the transverse process. Yes. It is also enclosing the quadratus lumborum from anterior and posterior. Yes. It is also having attachment on the lateral aspect with the transverse abdominis and internal oblique muscle. Yes, that is also true. Are you able to follow? So let us go back to the this statements. All are true. Attached to spinous, yes. Attached to transverse, yes. It gives attachment to these two muscles. Choice D is also true. Fascia lies posterior to posterior wall muscle. It is partially true because anterior and posterior, not only posterior. That's why answer will be C. That's why answer will be C. Next question. Injury to bulbar urethra leads to extravasation of the urine in all of the following except. So bulbar urethra, where it is present? See, this is the bladder. This is prostatic urethra. This is membranous urethra, which is present within the deep pouch, but below it makes kind of bulbar swelling, bulbar enlargement, which is called as bulbar urethra. Now this bulbar urethra is present in the superficial pouch. If it is getting injured here, it can spread to the pouch, it can spread to the you can say thighs also, up to the Holden line. It can go to the anterior abdominal wall, but it won't be able to go into the deep pouch because deep pouch is a closed pouch. Okay, so that's why answer will be B. It will spread in all the areas except this. Right, this is the Holden line. If you take from pubic tubercle, if you take a straight line, that will be called as Holden's line. Corticospinal tract crosses at. Now that is a straightforward question. Answer will be lower medulla. Corticospinal tract crosses at the level of lower medulla. Killian's dehiscence. You wanna try this question? Killian's dehiscence is seen between what? I usually describe this by explaining in terms of our room. Suppose where we are sitting in our room, okay, we have the wall on both sides like this, but between the wall we have the windows. Continuous windows are present. Just imagine that. So where this window is present, that is a kind of weak area. Na wall is not complete, window is there. But even though window is there is no problem. We have put one curtain inside. This is suppose curtain. This is suppose curtain. In our room, we are sitting comfortably. Curtain is blocking the windows. Windows present, no problem. But what will happen if you put high-speed fan? Then this curtain will go out of the window. Yes or no? So in a similar manner, we also have a gap between the two muscles in our body. Which two muscles? Between the thyropharyngeus and the cricopharyngeus. This gap is always present in all the individuals, and this is called as Killian's dehiscence. This is normally present, but we don't have any problem. When the thyropharyngeus contracts, then the cricopharyngeus relaxes so that food can move, no problem. But in case of error, suppose when the thyropharyngeus is contracting, at the same time crico is also contracting, then the high pressure zone will be created now, because from both sides contraction is taking place. In between, high pressure zone will be there and the mucosa will go out and making a diverticulum. Can you tell me? Yes, very good. That will be the Zenker's diverticulum. So could you correlate now? Is it clear picture in your mind what is happening, right? Now what is this? Identify the following hemorrhage. This, if depending upon what type of picture is given, subdural or epidural, like that. If it is you see concavo-convex, then it is subdural. If it is biconvex, then it will be epidural. And also along with that, what we need to understand, that we need to remember this. If they ask you most common vessel, then answer you should be ready with the answer. If they ask you extradural hemorrhage, then it will be anterior division of middle meningeal artery, most common vessel. If they ask you subdural hemorrhage, it will be the venous bleeding, that is bridging veins. And subarachnoid hemorrhage, then we have berry aneurysm. For the subarachnoid hemorrhage, the history will be the thunderclap headache or worst headache of life. Okay. Intracerebral hemorrhage, there will be Charcot artery of the cerebral hemorrhage. Okay. So these are important vessels that we need to remember. Now what is this? Straightforward. These all gas bubbles and everything in the chest wall, if we do not expect, it is the abdominal content going above. Why? Because of hernia. Which hernia? Congenital diaphragmatic hernia. Right? Now if we summarize this, we have these components from where the diaphragm will develop. This central tendon is coming from the septum transversum. The crura is coming from the dorsal mesentery, and this is the larger peripheral part coming from the cervical myotome, and the small peripheral part which is coming from the pleuroperitoneal membrane. In fact, this pleuroperitoneal membrane defect only, it will lead to Bosch-Dellek hernia. It will lead to Bosch-Dellek hernia, and this Bosch-Dellek hernia is basically a most common type of congenital diaphragmatic hernia. Is that okay? Right? A pediatrician noted that some green colored liquid matter is coming out from the umbilicus of a newborn baby. Now what is the answer? If this green color is, that is fecal fistula, meconium is coming out, it is because of the complete persistence of entire duct. That means A will be the answer. Because if the vitreointestinal duct, which is present only in the fetal period, if it persists, then the fecal matter will be coming out, right? And it can lead to different other combinations also, that depending upon which part remaining patent and which part is undergoing obliteration. Okay. A male child presenting to the pediatric surgery OPD with the complaints of swelling in the inguinal area and the herniation of the intestinal lobe, which is reaching up to the scrotal sac along the spermatic cord. Along the spermatic cord, it is going in a pediatric age group. It has to be indirect inguinal hernia. Okay. Indirect inguinal hernia because of the patency of this inguinal canal, and then it is going along with that a spermatic cord, it is reaching the scrotal sac. Okay, direct hernias are usually seen in the later part of life. Now what is this plane A? What is this plane A? What is plane B and what is plane C? C is the transverse plane. C is the transverse plane B is the sagittal plane and A is the coronal plane. Okay. In fact, this A, B, C, D, what we have written is directly A, B and C. These are true. Okay. Anterior abdominal wall, the nerve lies between. Let me tell you, even if they ask the thoracic wall or they ask the abdominal wall, the nerve and vessels are present between the second layer and the third layer. So in between the, if they ask abdominal wall, so second layer and third layer means we have the internal oblique and the transversus abdominis muscle. That will be the answer. And in case of thoracic wall, we have the intercostal intimi as well as internal intercostal. What is this structure with the blue arrow? That is epiglottis. That is epiglottis. Now what is this? This is anencephaly. The case is anencephaly. How does it happen? If the failure of closure of anterior neuropore will be there. Can you tell me the failure of closure of posterior neuropore will lead to what? If posterior neuropore does not close, then it will lead to spina bifida, right? If the posterior is not closing, it will lead to spina bifida. Anterior should close by day 25. Posterior should close by day 28. Alright. Identify the type of joint discussed in the given X-ray. Here we can see the symphysis pubis. That is definitely secondary cartilaginous joint. Symphysis by definition is secondary cartilaginous only. Okay. Let us revise these joints. Joints is again an important topic. Let us revise. So for the joints we have fibrous joints and cartilaginous joints and the synovial joints. Sorry. Fibrous joints we have further types like sutures is one of the type. Sorry for today, actually I am not feeling well, but the session was important and I had to take. Please bear with me. So we have the fibrous joint, that sutures, that is the skull bones. We have the sutures over there, and particularly one suture is a special type that we need to remember. Schindler's is a special type of suture which is seen between the rostrum of sphenoid and the vomer bone. Okay, like that. Syndesmosis, when they say between the two bones we have a fibrous ligament present, fibrous membrane present. Okay, radius and ulna ke beech mein we have middle radioulnar. If you go for the counterpart, middle tibiofibular, but additional one is there, that is inferior tibiofibular. So these are the examples of syndesmosis, right? Gomphosis, gum and teeth, simple. And now next is the primary cartilaginous joint, which we need to memorize these examples. The joint between epiphysis, diaphysis, spheno-occipital, first chondrosternal and all the costochondral joints. Secondary cartilaginous particularly, they are called as symphysis. And also let me tell you one hint. What is our hint? Symphysis will be always seen in the midline of body. How? See this. Symphysis bentic. Then we have manubrio-sternal joint. Then we have Ziphi-sternal joint. Behind we have intervertebral discs. And lower down we have symphysis pubis. All these are nothing but the secondary cartilaginous joints. These are the synovial joints. So we have like plain intercarpal, intertarsal, intercarpal, intertarsal, intermetacarpal. All these are the plain type, but interphalangeal is not plain. Interphalangeal will be hinge type. Okay. And what about this pivot? Pivot ke liye we will remember this mnemonic, that our mnemonic says RUPIA. What is RUPIA? PI is for pivot, RU for radioulnar, and AA for atlantoaxial. Okay. And in the ellipsoidal we have atlanto-occipital. When we say no movement, it is done at the atlantoaxial joint, and the yes movement will take place at the atlanto-occipital joint, that is the noding. Okay. Do you appreciate this? Alright. And if I give you one mnemonic here, our mnemonic is Miss Bahl. What is Miss Bahl? This is Malleus, Incus and Stapes, three ear ossicles, and this is saddle, and this is ball and socket. So first joint is of the saddle variety, second joint is of the ball and socket variety. Alright. Now identify the arrow marked structure over here. This is now what structure is this? You want to try this? Is it descending aorta, ascending aorta, what? This structure is descending aorta, and here it is present. Here you can see that we have the ascending aorta here. This will be the esophagus over here, and this is the descending thoracic aorta. These are the content of the posterior mediastinum, okay? And the previous picture we were looking in a section. So sometimes they give you section also. These sections are important for us, okay? So this is, I am adding here one labeled picture so that you can practice once, okay? And you can visualize this. What is this structure? What is this structure? Right? This is left atrium. This one is left atrium. Let me explain here. This is the sternum, right? Behind the sternum we have the right ventricle. Further behind we have left ventricle. Further behind we have left atrium, which is towards the base. Base is the posterior part of the heart. Posterior part of the heart base is contributed by both atria, but mainly by the left atrium. So we have the left atrium. Here we have the right atrium towards the right side. What is this muscle? Straightforward. In the trachea we have the trachealis muscle present over here. Now this is also straightforward. That is the type of epithelium found in the fallopian tube. Now what is this vessel? So in the posterior part of the leg we have posterior tibial artery, which will go in the plantar aspect of the foot, plantar artery. This is posterior tibial artery. But here we have anterior tibial artery, which will become here dorsalis pedis artery. We check the dorsalis pedis artery for the peripheral vascular disease. Okay. What is this bone here? Right. This one is the medial aspect. So we have the navicular bone over here. In child, spinal cord ends at which level? In child, if they ask, then it will be L3. In adult, if they ask, then it will be L1 level. Known case of leprosy, first hint is leprosy. Okay. Then it is coming as shown in the figure. Such a deformity is because of palsy of this deformity. The figure was there, but figure is not given here, so it is lacking. But actually, it is the ulnar claw, and the leprosy is again a hint. So it will be ulnar nerve involvement, right? Identify the march structure. It is straightforward. It is bones. This is midbrain. This is medulla oblongata, and this is cerebellum. What is this tendon? Here we can see the tendon of you can say one tendon which lives alone. You remember? I told you how to remember this. Extensor pollicis longus and brevis. These are two brothers. But longus live alone. Small brother lives with the abductor pollicis longus. You remember? So A will be the answer, which is living alone here. What action is done by the arrow mark structure? It is the supraspinatus will be doing the abduction of the shoulder joint, actually initiation of the abduction, right? If they ask you the levator scapulae, then you go for elevation, because levator means elevation. But if they ask you rhomboideus muscle can do the retraction, they can do the elevation, okay? Also they will lead to the glenoid cavity facing downward. Identify the type of arrow mark joint, right? Again we have discussed syndesmosis. Inferior radioulnar pivot. What is this arrow mark structure? We have just now formed antrum. So antral follicle. If antrum is very well developed, it will be Graafian follicle. Antrum not developed, it will be primary follicle. Right? This picture I have added so that you can just correlate. Right? Now the question is this: the patient having the fracture, which is the most common junction, medial 2/3 and lateral 1/3 should be the answer over here, beta, है ना? But it has been revised. Now it is 3/5 and 1/2. Now it is 3/5 and 2/5. So question can be framed in both the ways. They can ask for 2/3, 1/3. They can also give you 3/5 and 2/5 like that. Now what will happen in case of hypoglossal nerve is injured? If the hypoglossal nerve is injured, then the tongue will be diverted to the side of the lesion. So answer will be A. Again the similar type question, unilateral hypoglossal nerve, the tongue will be protrusion, deviation to the ipsilateral side, towards the affected side. Towards the affected side. If this muscle is not working, the deviation will be towards the affected side. Alright, I hope everything was fine dear students. ठीक है, और now the exam is coming very close. ठीक है, अभी अपने को और ज़्यादा मेहनत करनी है, और याद रखेंगे जीतने का मज़ा तभी आता है जब सभी आपके हारने का इंतज़ार कर रहे हो. ठीक है, when you wake up dear students in the morning, always tell yourself that I am going to crack this exam this time. I am the best and God is with me. Okay, and this is my chance. I am gonna prove it. All right. So with this positive thoughts, go for it. My prayers are with you. All the very best dear students. Okay, and please get in touch with me on all these platforms, and once you crack it, you please inform me, please update me. I will be very happy and I'll be eager to know about your results. I know that you are going to crack it. Okay, so we will wait, we'll meet for your celebration, right? Okay, take care. Good night. Thank you. God bless you all.